Now, good afternoon, Mr. Gale.
Good afternoon, my lord. The next witness is Mrs. Eileen Cawley.
Good afternoon, Mrs. Cawley.
Good afternoon.
Mrs. Cawley, could you give the inquiry your full name, please?
It's Eileen Rose Cawley.
Thank you. You have provided the inquiry with a statement, and you're agreeable that that statement should be published and that the evidence that you give today in amplification of that statement is broadcast and recorded.
That's absolutely fine, Mr. Gale.
Thank you. You are the administrator, oblique development officer of an organisation called the Scottish Pensioners Forum.
That's correct.
You've been in that role for 14 years, I think.
Yes.
And you're employed in that role through the STUC.
That's correct.
You tell us about the forum. I'll just call it the forum for sake of brevity. In paragraph 8 and following of your statement, and just taking things shortly, it's an organisation that's been in existence since 1992.
That's correct.
And as you say, it's an umbrella campaigning body for groups and individuals working for a better deal for older people.
That's correct.
And it has close links with the STUC.
That's correct.
And I think we can see from paragraph 11 that it has 350 individual members, but through, I think, 160 affiliated organisations, it represents hundreds of thousands of older people in Scotland.
I think it's recognised about 113,000, taking into consideration retired trade union branches across Scotland.
And I think it also represents the rights and needs of retired trade union members.
That's correct.
Yeah. And I think also the cohort of older workers as well.
We started doing work on the older workers when the state age, pension age started to rise. We had to take into consideration that older people, would they ever retire? So we started doing work on older workers, which fed into the framework for older people, the programme for government, the Scottish Government in 2019.
Thank you. Your personal background is that you worked in the third sector as a volunteer.
Yes.
For a while. You have I think you have had some background in accountancy.
That's correct, yes.
And but through that work in the third sector, you became interested in equality and human rights.
Yeah, I went back to university when my son was young, and I studied social sciences and worked voluntarily in the third sector, and that piqued my interest most definitely.
Now, the forum has experience of surveying older workers, and this allowed the organisation to carry out some surveys during the pandemic and also to carry out what you describe as deep dive exercises.
That's correct.
Can you tell us what a deep dive exercise is,
Deep
please?
dive exercise was actually reaching out to people that had been affected by a number of issues. To tell the inquiry, I was actually elected onto the board of the Social Renewal Advisory Board, which was set up by the Scottish Government. So I served on that board. And as part of the policy circles, we had to conduct deep dive exercises looking at the effects of COVID on older people.
Right. Obviously, with the commencement of the pandemic, your way of working, as it was for everybody, changed, and as did your interaction with your members at the time.
Yes.
We'll go on to discuss issues of digital exclusion, which is one of the principal areas that you're going to talk about. But you do say at paragraph 24 of your statement that some members dropped off the radar in communicating with you because they were digitally excluded. But there was, at the time, an increase in phone calls.
Absolutely. More people were calling. I had my phone diverted onto my mobile device in order for people to be able to contact me. In terms of digital exclusion, all of our meetings were in person on our committee, and we engaged in a lot of outreach work. Unfortunately, that had to stop. Even the meetings of our members and our committees, sometimes they weren't even coded, and in order for these to be coded, I would actually get 3 mobile devices in order for them to phone in and put it on loudspeaker so that they could hear the proceedings that I had in the laptop. And that gave them a sense of inclusion in what was going on, because many of them were deeply affected.
We'll come to a little more about digital exclusion in a moment. You did engage as a forum with the Scottish Government, and one of the things you refer to in your statement is cross-party groups on older people and age and ageing. What were you doing, or what was the forum doing in connection with that engagement with the government?
The last in-person meeting that we had was on 11th of March 2020, when it was the belief that everything was okay and things wouldn't be going as bad as they were, that older people were seeing on the television. Unfortunately, that didn't pan out quite that way. We held online sessions, which meant a lot of older people who could engage in these conversations dropped off. But just prior to lockdown, I would say around about the tail end of 2018, 2019, the Scottish Pensioners Forum contacted Jean Freeman, who was then Minister for Older People, and along with another organisation who are now no longer operational, the Scottish Seniors Alliance, we set up the Older People Strategic Action Forum, which was a specific mechanism to engage and liaise with policymakers at Scottish Government level, which would be chaired by the Minister for Older People. And within that time, I must say, immediately when the first lockdown kicked in, there was emergency funding put through that in order for older people's organisations to remain operational to a degree. That was only set up to be approximately 3 meetings per year, but that actually stepped up to about 7 meetings per year. And people within that committee were actually appointed to speak on the rights of older and welfare of older people on specific boards that were set up by the Scottish Government.
Maybe it's sort of fairly obvious, perhaps fairly obvious now looking back, but what areas in particular were you campaigning for or discussing with the Scottish Government at that time? Probably
the first meeting of the Older People Strategic Action Forum, where we had to go online. I remember actually saying to the then Minister for Equality and Older People, this is, a pandemic is all, you know, we're going through this now, but coming through this, there's going to be an even greater pandemic in terms of loneliness and isolation. And I think I've been proved right on that. So that is something that we had to work really quickly on. I think there were community groups that were given specific funding to perhaps have about 10 or 12 tablets to people who are most in need and try and help older people to work with these. But with the, you know, in terms of the libraries were closed down, there was no local authority hubs for older people. So in terms of it, they were cut off, and that was glaringly apparent.
Interestingly, what you just said, that you made that representation to Jean Freeman at that time.
It was
that was something you envisaged would occur.
Yeah. Well, going back, there had been surveys up to 2014, 2015 in Age UK and on older people in Scotland over age 65. I have stats, but obviously I won't be using those. However, we actually done a 3-year programme of work along with retired trade union members branches on loneliness and isolation, on the transition into retirement. So it was something we were really ahead of. In January 2018, a Connected Scotland draft strategy first came out, which was adopted in December 2018. So there had been moves to appreciate that there was an issue on this in Scotland. However, 14 months in, and then we were in the midst of a pandemic. So there was action towards that, but it was not too little too late, but there didn't seem to be an emergency plan in place.
No. So far as, and we will be looking particularly at pre-pandemic planning later in the inquiry, but in those early days, in March 2020 and just thereafter, did you get the impression that the position of older people in Scotland was something that had been thought about in the context of what might be a pandemic?
I don't think anyone could envisage what was going to happen. I think there was plans put in place, but that it was a bit too little too late as far as I'm concerned, because there were surveys in place 2013, 2014 looking at this, and the strategy came into place about 5 years later.
Okay. Your communication with your members, you tell us in paragraph 27, and perhaps alluded to this already, that the increase in telephone calls you received was an increase of about 400%.
That's correct.
What were people contacting you about?
There was people contacting me at 11 o'clock at night, saying they were in hospital and they had no one to talk to, and they were wanting me to help them write their eulogies. And that's a true story. Because the number was made available, it was transferred onto my mobile device. I wasn't not going to answer a telephone call.
Yeah, I was going to ask, how was your number out in the public domain?
It was the office phone transferred onto the office telephone number transferred onto my mobile device. So it wasn't my personal number per se.
Was it you alone who was answering the phone, or did you have any help?
No, not with the telephone, but I did have executive committee members who were digitally savvy, shall we say, and they were, I was always in touch with them or phoning them and trying to do as much as possible. But in order for older people not to be cut off entirely, we do 4 quarterly newsletters per year, and that we'd done another 7 in that first year, in order for older people to feel engaged, because there were a lot of older people who were hearing things through the news, but there were also at that time an awful lot of older people who were scared to turn on the television because there had been a drive for the removal of their TV licence, and they hadn't paid it, and they were scared to watch the television. So we had to keep them, keep contact with them, maintain contact with them, to let them know someone cared. And myself and 2 of the other members of our committee looked at our database. Obviously, we had to be compliant with GDPR. And the people that were on that were phoning older people and our members to check in that they were okay.
Paragraph 28 of your statement, you give an indication of some of the issues that were being discussed with you. One was a concern that care packages were being removed. Yes. Was this actually happening, or was it speculation?
No, it's not speculation. They told us that it was actually happening, and they had notification of that. You've got to bear in mind, that a lot of older people are not those in 68 or people of pensionable age or over 70 or 75. The category, even within the Scottish Government, is people 55 and over. So there was people who were perhaps disabled. They were saying, are there other people who can help look after you within the household? So we have to actually prioritise care packages, and even in terms of that as well, there were staff going in who were having added responsibilities, and that is something that I have heard from several social care workers, that people were being added on to their worksheet, and they were the only people that older people were seeing. Mm-hmm. So in order to prioritise who would be seen, these would be cut back to safeguard workers, which is absolutely the right thing to do. However, it's the people who were being left behind that was the issue.
Obviously, we can envisage the problems of loneliness, and you've mentioned that as one of the issues that you were being phoned about.
Yep.
But you also say that older people were frightened. And again, we can all remember what it was like in those early days, not just for older people, but for all of us.
Absolutely.
And I'd like to think I'm not old, but that level of fear, was that something that surprised you?
Within my committee, yes, because most of my committee members, the committee members that we work with, are retired trade union members who are there to fight for the rights of older people. Now, obviously, I become very, very close to these people, having worked with them. And to see some of them facing their mortality for the first time, it actually was really, really, it was awful to witness. Mm-hmm. It really was awful to witness. And we engage very widely with people in Dundee, North Ayrshire, Edinburgh. We have several local organisations, or shall we say, local forums on our committee, and they were finding the same thing. We were in constant contact. They were older people weren't allowed to go out. They were told that if you go out, you die. During this time, the increase of scams online, phone scams escalated, so they were worried about that. They were calling about that. They were calling about their GP, saying, they were going to put DNRs on them, and I know the Scottish Government had nothing to do with that and didn't endorse that in any way, but that was happening. Mm-hmm. So they were scared and they were alone, and there was work that we had done around about 2015, 2016, where we found that across Scotland, children over 35 lived 113 miles away from their older parents. Now, that is something that is logged. So, even within the local authority boundaries, even when restrictions were being lifted, a lot of older people couldn't see their family because they couldn't travel. They couldn't travel or use transport to get to their banks because that was out with an area. So they were generally cut off from their money and lots of other things.
Now you mentioned the message, whether either directly or indirectly through inference, that to older people that essentially if they went out, they were at the risk of dying. Mm-hmm. Do you feel, from your perspective, that the tone of the information that was being conveyed, particularly to the older population, was appropriate?
It could have came across as being patronising to a degree. However, I do feel that initially it came from a good place, of a caring place. Although that we're not speaking on that, but on the television you've seen, who was dying. And by May 2020, 90% of the people who died from COVID were older people. And that's public knowledge, that's out there. That's the Communities Division of the Scottish Government that's actually put that out, so that's out there. So yes, initially, it was the right thing to safeguard older people. I was a shielder. I wasn't initially on the shielding register, but my cardiologist called up and gave my GP short shrift, so after that, you know, I had to get injections and things at home and things as well, so it was quite worrying for me too.
Right. Can we move on to digital exclusion?
Absolutely.
Because I think this is one of the main areas that you are referring to. You talk about a survey that was carried out in November 2020. It's a paragraph 32 of your statement. In general terms, what did that survey disclose to you?
It disclosed that people were generally being cut off. Over a third, 36% of households where adults over 65 did not have home internet access, and this rose to 3/5, 60% of households where all adults were over 80. 2/3 of adults aged 60 plus used the internet in 2018 compared to 1/3. So it was moving in the right direction. However, because of the speed of things that were taking place, no one could get access to the shops even if they wanted to try, if they were digital savvy. To get that, there was a drive towards smartphones. People couldn't access food. They couldn't, if they weren't on an online bank, if they went into the bank, they couldn't access their money. So what happens there? GPs, everything was going towards online. How can you diagnose someone who doesn't have a smartphone, who can't send you a photograph of their ailment? And how degrading is that actually for someone of an older age as well, to actually feel like that?
There's also a problem of access to medication, I think.
Yeah, absolutely, yes. Although the Scottish Government had never endorsed this, there were some pharmacies, larger pharmacies, who were charging a £5 delivery charge, and you could only access prescriptions online. And if you wanted the delivery of a prescription, you wanted access to your medication, you would have to pay this £5.
I think you make the point that there would be some people who would be requiring access to the medication more than once a week.
Yeah,
so
well, yeah, absolutely. As well, you know, it's all right saying that there are repeat prescriptions, but not every medication is on a repeat prescription, and it has to be called up or put in online, and that couldn't happen.
I think you tell us that after some negotiation, this was set aside. Were you involved in that negotiation?
It was me that done it.
Right. And how did you feel about having to do it?
I felt it was shameful. You know, it was people profiting from older people, and or not just older people,
Yes.
other, you know, younger people, disabled people, people with long-term health conditions. It was a way to make a quick buck, and it actually made me feel quite ill.
I suppose one of the aspects of digital exclusion is the fact that individuals don't have, or some individuals don't have, or didn't have, the equipment to facilitate that communication. So either an internet line or a tablet or a smartphone or a laptop, they didn't have that equipment. Was any thought given to perhaps making some efforts to provide that sort of equipment to people?
We're a campaigning organisation rather than a service user,
Yeah.
Mr. Gale. In terms of that, we have organisations that actually had carried that out within the community that we worked with on the Older People Strategic Action Forum. And, you know, when we were at these meetings, I would say to them, you know, this isn't just about the Scottish Pensioners Forum. Tell us what you need. I will feed this into policy circles, etc. So their views were taken into consideration.
The other, I suppose, difficulty is even if you have that equipment, you have to know how to use it.
Absolutely. There were some, as I says, community groups that, you know, that could go out because they were health and social care workers, etc. But you've got to take into consideration as well, if you don't have internet access, you're looking at people in rural areas as well who were just basically cut off. You know, 15% of older people are, you know, suffering pensioner poverty. And if you don't have the money to actually pay for an internet provider, then you're just cut off.
I'd also ask you, again in relation perhaps to digital exclusion, but to ask you a little bit about access to food. You mentioned this at paragraph 38, and one of the things you say is that older people did have obviously a concern about attending shops at that time. So to physically go to a shop was off-putting to many older people.
You know, it's a very daunting prospect to be told that you need to look after yourself, and actually to go out, if there's not a shop that's local, you had to go on transport if it was made available. You know, if there were buses or whatever, to go to a shop and then find that it's packed or there's nothing left for you to eat, or there was the process of you can bulk buy and then it's perishable and they don't really have the money to do that. When the supermarket lines were first introduced, there was specified times for older people to go along. Even then, the prices had escalated. I spoke to one man who had actually went to the shop just prior to the pandemic, and he thought, I'll have money for this to pay my bills, and he wanted a packet of ham and a loaf of bread, and to know it went up by, I think that the ham had gone up from £1.39 to £2.79 for the same ham. So he couldn't make himself a sandwich, so that was him not eating.
Obviously, some suppliers, some supermarkets did provide a facility that you could order online, but a lot of them, as my recollection was that you had to have a minimum spend.
£50, £50.
What good was that to an elderly person living alone?
It wasn't, because again, older people are very specific in the food that they need. It's smaller portions. There would have been waste, but the crux is they couldn't access it anyway because they were digitally excluded. So even if they did have the money to buy this and they could afford it, most of it would have gone in the bin, you know, in terms of perishables.
We have heard evidence from, particularly an organisation in Glasgow, that was making available small packages of food to people, principally those who are disabled, but living on their own. Is that sort of situation that you have heard about?
I have heard about that with other organisations, yes.
Yeah. And of course...
Can I ask, was the £50 minimum charge, did all supermarkets charge that?
The majority of, they offered free delivery if you spent over £50. I think the minimum spend in some were £35. However, if you didn't spend the £50, you would have to pay delivery, and I think sometimes that was as much as between £8 and £10. So I think you would probably attempt to try and get the free delivery and buy food, but rather than not naming names in certain supermarkets, I know there was one at £35, but the majority were £50. And you had to have a shielding letter or evidence that you had to download. So if you didn't have the facility to do that, you wouldn't be, because there was conditions set that you had to be a shielder or over a certain age, and you had to provide evidence of that. So this is all things like, if you don't have a smartphone to take a photograph, not everyone has a camera to hand, especially if you're staying on your own and you have no one who can come to see you and tell you you can do that. So it was frustrating, demoralising, and people were feeling just cut off let down and facing death, basically.
Right. I have mentioned already the removal or fear of the removal of health and social care packages for certain people. There would obviously be a concern on the part of those who are providing those packages going into older people's homes. Is that something that you came across?
Yes, that was part of a survey that we'd done on COVID-19 and the safety of older workers in terms of health and social care workers. They were afraid because they were going in and families were not taking into consideration. We found it a lot in areas of social deprivation, and families were not taking heed of the need to safeguard not only their loved one, but the people that were actually carrying out the service.
I think also that so far as the recipients of care packages, one of the other concerns would be the information that was being put out into the public domain of the number of deaths of people of comparative age in care homes.
Absolutely, that was a huge issue. That was a huge issue. People were scared. They were angry of the fact that older people were just basically being left behind, and that was the attitude of a lot of people in the beginning. Yes. Seeing the older people were basically just being transferred from hospital into care homes without any real packages being put in place. That was an issue. That was an issue.
Yeah. You mention in paragraph 43 of the statement the impact that you identify, particularly the closure of weekly clubs and similar hubs where older people could meet, and the impact that had on mental well-being. Tell us a little about that.
Yes, absolutely. People's mental well-being was declining rapidly. A lot of the stuff that we had actually done on loneliness and isolation prior to this, seen that people's engagement with other people in these community hubs was a lifeline, because when they had given up work, most of their social interactions was with people within the workplace. So when they retired, they would find ways to meet other people, to go out, and a lot of this was within community hubs. But as these were run by local authorities, these were all closed down. They were closed down. They had nowhere to go. If they lived alone, that was it. They were alone. If their family couldn't, form a bubble or contact them or visit them, then that was a huge issue. So sitting staring at the walls, facing the inevitable, it would drive anyone to think that this was it. I'm going to die alone here. I'm not going to have any access to food. I have my television, if I'm allowed to switch it on. I have books that I've read over and over again. I'm going to bed and I'm waking up in the morning, and it's over and over again, the same cycle. Tuning in to see what's happening next, if they can actually get out and about. But even now, people they're not the same anymore.
Yeah. That's what I was going to ask. Is there a long-standing consequence of that?
Yeah, and local groups and forums in particular. We have one in the Renfrewshire area that the person that organises that is on our committee, and that's operational very quickly, but the majority are not. North Ayrshire in particular is really finding it a struggle. Dundee is finding it a struggle. So the facilities aren't there anymore. Libraries, when they're open, you can't access because they're scared. if it's too crowded, because people will use, if it's limited hours, more people will use it, and they're even scared to go out. It's actually horrible to see when I've worked with so many older people who have been active and have been the driving force of making sure that older people's welfare and rights are at the forefront of everything they do. To see the demise in them, it's actually really quite difficult to watch.
As one gets older, one becomes aware of one's own potential mortality, but also you become aware of it through the deaths of your contemporaries. Was that again a problem? Because a lot of people would be seeing, not even necessarily from COVID, but just simply the progression of the aging process. People would be seeing the deaths of their contemporaries, and the restrictions on funerals
Absolutely.
were considerable.
Huge issue. Because a lot of the funerals were limited to about, maybe it was some 6, some as many as 20 in some areas. I actually sit on a cross-party group on funerals and bereavement, so that was something that I continued to bring during the meetings that we had there. And the fact that you couldn't, the funerals were going online, and they couldn't access online funerals even to say their goodbyes through that way, because they didn't have a tablet or a smartphone or a laptop. No. So that was it. The only thing that they knew was someone phoning them up and saying someone's dead, and they didn't have time to grieve. They had sitting with those thoughts. So we can only imagine what that would do to someone's morale and their mental well-being. They can't grieve. I had one in particular in Eileen. A sibling and an in-law died. They couldn't travel. They couldn't watch their funeral online. And they didn't really have any social interaction for another 9 months.
Right. Mr. Cawley, those are really all the questions I want to ask you. We've got, at the end of your statement, helpfully your lessons to be learned, and you've focused those very clearly for us. And I hope I've concentrated a little on the difficulties of digital exclusion.
Absolutely.
As you've given your evidence. You've also told us your hopes for the inquiry, and I should say we are conscious of the DNR issue, and we are looking at that specifically. But at this stage, is there anything further that we haven't perhaps dealt with that you would like to say?
I would like to say that during the pandemic at its worst, we have to look at the youth who really stepped up. They were not at school. They helped out as volunteers in communities and whatever, as much as possible to reach out to the most vulnerable people. And the driving force behind the demonisation against old and young people has to go. There are so many groups out there, intergenerational practices, and I think we're sitting at Global Intergenerational Week, and we need to look at that. There has to be something, more money goes into that to ensure that, that the understanding is that older people and younger people get one another. They really do. I had one young boy in Aberdeen just in 2022. And it was one of the first events that I could go to. Now, he came to our stall. We have our newsletters and everything. And he came up and he took everything. And he wanted to give me a donation. And I said, no, please, what you're taking and taking away to read is the most important thing for me. And he said, I want to help. I want to know more about this. And it has to be out there about the wealth that older people bring to society. Because I thought I was going to lose my gran. And that really opened my eyes. And he was 17 years of age. So people do care about one another, and we need more funding or work put into this, to the understanding of all ages across society. We need to respect one another. It's hugely important.
Oh, that's a very profound point. Mrs. Cawley, that's all I have to ask you. Thank you very much for engaging with the inquiry. We're very grateful to you.
Thank you, Mr. Gale.
Yes, thank you indeed, Mrs. Cawley. That's all. Now, Mr. Gale, I have received through the miracles of digital connectivity, which we have access to, fortunately, the information that the next witness is here. So we have finished this witness early. We can, unless you have any objection, and start the next witness at, I would have thought, 5 to 3.
Yes, certainly, my lord. Yes.
Thank you very much indeed. Good. That's what we'll do then. No. Good afternoon again, Mr. Gill.
Good afternoon, my lord, again. Next witness is Mrs. Annie Hare.
Good afternoon, Mrs. Hare.
Hello.
When you're ready, Mr.
Thank
Gill.
you. Mrs. Hare, could you give the inquiry your full name, please?
My formal name is Anne Merleys Hare.
I think you're known as Annie.
Yes, I'm known as Annie, yes.
You've provided us with a statement. The reference is SCIWT 0271 and 501. And you're agreeable that that statement be published, and also the evidence you give today in amplification of it
I am.
is recorded and broadcast.
Yes,
Your background is in nursing, I think, is that right?
that's correct.
And you have, as you tell us in your statement, a wide and extensive experience in nursing.
I do, particularly in community nursing,
Yes.
and I've been a nurse for 50 years.
You tell us also that you continue to work full-time as a senior nurse for practice development
That's
for
correct.
children and families,
That's correct.
and you're employed by the Greater Glasgow and Clyde Health Board,
That's correct.
and that's within the Health and Social Care Partnership.
That's correct.
You're also a senior shop steward for the Unite Union.
Unite the Union and Community Practitioners and Health Visitors Association.
And I think at paragraph 2 of your statement, we see that for the last 15 years, your specific role in Unite is for community practitioners and health visitors association.
That's right. I work at both an industrial trade union, but in that aspect, I'm a professional trade union representative.
So can we unpick those various roles a little? Can you indicate what is, if you have a principal role, or what the various roles involve?
It's very hard to separate industrial matters from professional matters, but professional is very perspective around the impact on health visiting and nursing. The industrial is on policy and processes, and I am 50% employed in NHS GGC in my professional role as a health senior nurse, and 50% I'm on this partnership forum with facilities time for the trade union across both these roles.
Thank you. You're here, as you say in paragraph 3 of your statement, to tell us about the impact of the pandemic on your professional nursing role, as well as the impact on your union members.
Yes.
Now, just as a point that I want to make at the outset, Mrs. Hare, with your background, you've indicated at various sections of your statement the impact that the pandemic has had on the training of nurses,
Yes.
the closure of universities,
Yes.
the detrimental effect of distance learning,
Yes.
and then towards the end of your statement, at paragraphs 46 and following, you conclude by offering your expertise so that the inquiry is made aware of the impact of the pandemic on children,
Yes.
including the identification of certain developmental issues for children post-pandemic.
Yes. Professionally, receiving more and more contacts from our members who are concerned in their professional roles on the delivery of their services to children.
Now, you'll appreciate that within the inquiry you have another team that's looking specifically at education and the impact on children. Mm-hmm. And we have passed your statement to them, and they will be very likely asking you further questions about that and getting further details.
Thank you.
So at this stage, I'd like to concentrate on just some of the points around those points that you make in your statement. Can I begin, therefore, with some questions about redeployment,
Yes.
which you refer to at paragraph 17 in particular? And what you tell us there is that in your professional role, you were initially asked to provide a list of names to management to deploy into acute COVID care. And I think this is from the student nurses that you were...
It was postgraduate nurses studying the health visiting and school nursing specialist practice qualification that had commenced training in the previous September and indeed just commenced in the January. There was a significant number of them, oh gosh, probably about 54, and they were not deemed necessary. The courses hadn't yet stopped, and I was asked to provide the list of them so that they could be redeployed to acute care.
I don't think, as I read what you say in paragraph 17, it's entirely clear that that was an approach you were happy with.
I was not happy with the approach.
Could you explain why?
I felt to just give a list of names was inappropriate, that I had both a management and an ethical responsibility to these staff as a professional nurse. And in my union capacity, I sought advice. And we concocted a risk assessment form and detailed information form within 24 hours that would gather information looking at the skills and competencies of these nurses, where they had previously worked, what risks individually they may have as to their current health and status, and what their living arrangements were, to have a much more detailed understanding of how they would be best deployed. I had support from my professional lead nurse in that as well.
So what you were aiming for, as I understand it, was to attempt, if possible, to allocate a particular nurse to an area in which he or she would be more comfortable.
Yes, I didn't have responsibility for the allocation, but I could give the information that would assist those allocating.
Yes. You could, put it this way, you could probably make a pointed recommendation.
Indeed.
Okay. There is, in paragraph 19 of your statement, you give an example of a particular nurse who, as I understand it, because of certain, and we'll not go into details because we don't want that person to be easily or readily identifiable, but a particular nurse, I think, had a child with certain health issues.
Indeed, yes, who had a recognised would be in the shielding category and had indeed, by that point, received notification from her consultant to protect her child.
Yes. And what happened was that her husband and child went to a distant part of the country.
Yes.
And that nurse continued to work in high dependency.
She did. She had high dependency experience, and that actually was one of the nurses that went above and beyond and had already contacted her previous place of work to say she was being redeployed and could she be of help to her previous area.
The type of redeployment that you were involved in, was that something that, in your experience, was occurring in other areas, either geographic or within the health service?
Yes, we were well aware within Unite the Union of discussions with other union reps in other areas, and in my professional role within Unite, I cover the whole of the UK and was aware of this happening, particularly in London and other parts of the country.
Was it happening with the same degree of, if I can put it this way, investigation that you were carrying out to enable recommendations to be made for particular nurses?
I can only talk for myself, but I don't particularly think so, because I retrospectively have heard of people being completely out of their depth.
You do say that the end of, sorry, it's the beginning of paragraph 22. You say, I would summarize the redeployment process as complex and challenging.
Yes.
You may have already indicated that, but
yeah,
perhaps you could just give a little more detail.
Nursing comes in lots of different fields, and your practice and skills tend to be honed in a particular area. I don't think anybody who had dealt with a pandemic in its form before, but very few nurses would be able to walk into high dependency intensive care units. Many nurses will not have dealt with a lot of dying patients or care of elderly patients. They may be children's nurses, they may be neonatal nurses or midwives. Basically, every registrant was placed in an equivalent area, which could be high dependency, a medical ward dealing with very sick COVID patients, because you were very sick if you were admitted to hospital.
Yes. Were you aware of instances where nurses were redeployed into areas for which they perhaps did not have the background?
Yes.
And what was the, if you can give an indication,
I think
whether specifically or generally,
of
the effect that had on them?
There was increased stress in nurses, and I was set up a WhatsApp group for the colleagues that I was supporting, and also within the union. There were nurses who would contact at 1 or 2 in the morning in distress and crying. They were working long hours in PPE, high-level PPE, hazmat type suits, and not necessarily getting breaks because it was so busy. And we're dealing with holding patients' hands as they died, having their loved ones on a screen with a phone, holding a phone so that their loved ones at home could spend their last minutes remotely with their dying relative, and this was recounted to me. Some of our members also contacted us about their colleagues or family members who were working in other areas and were totally ill-equipped for, particularly in care homes. Some undergraduate nurses were working part-time in care homes and were not prepared for this level of care.
Yes, I was going to ask you about the WhatsApp group. This was something you set up yourself.
I did.
Again, you may have probably covered this. What led you to do that?
I was a request from the staff I was supporting, can we keep in contact with you? And I thought at that point, we were using within the union several WhatsApp groups, and thought this would be a useful way to make myself available but not be answering a phone or on a computer screen.
And the purpose, as I understand it, was to, I think as you put it, to provide a listening ear.
Yes, that was one of the purposes. It was also to provide up-to-date information or links to it as soon as I could, official information as it became available to me, but I had made a listening ear available.
Just a couple of, I wouldn't say incidental points, but taking your statement in the order. You, together with some of the students you knew, volunteered to do some extra shifts in connection with the vaccination program.
That's as soon as the vaccination became available. I volunteered because I had largely been working strategically in the background. I was of a certain age that was not particularly going forward. My husband was shielding. However, the vaccination enabled me to offer, and I did most weekends and evenings, 2 or 3 a week for a period of about 4 months, offering vaccinations.
Going back or onto the WhatsApp group, one of the areas that you say people who were calling you or contacting you through the WhatsApp group were raising concerns about was about the availability and adequacy of PPE.
Yes, there was concern, particularly on ward areas, of not having what was called face-fit masks.
Yes.
And just normal waterproof blue masks, which we all used.
Yeah. Now, we've heard quite a bit about face-fit masks, and I think we probably have an image of what that involves, but from your experience perspective, can you just tell us what is involved in face-fitting a mask?
Somebody had to be trained to recognise that, to understand how the mask fitted on the face, and they had 3 or 4 sizes that they would try to create a seal on the face, and then they would blow air or something on it to make sure there was no gaps. And obviously facial hair could not be in the way, so people were having to remove their facial hair to do that. Certain types of faces did not fit. Very small faces there was a struggle with, and I think I cited further on in my statement.
You do indeed. I was going to ask you about that.
Yeah.
It's paragraph 52.
Yeah. One of my union members contacted me. She was previously a theatre nurse in anaesthetics, so was well equipped to be working in intensive care areas. Theatres were turned into intensive care. And she is of South Asian origin and could not get a face fit mask to fit. She felt slightly vulnerable throughout that period, but continued to work with an ill-fitting face-fit mask until the Army were drafted in to support NHS GGC, and they made Army issue rebreathers available to this particular member of staff,
Yes.
which is the type of mask you would wear in a gas attack.
Do you have any comment to make about the lack of provision for persons such as the nurse you're talking about?
I don't think anybody had thought of the impacts of that on individuals. Everything was geared towards white Caucasian hair-free faces.
Yes. Okay. And also probably male.
Male, yeah, well, I think the small masks fitted females, yes, but they weren't moulded to individuals. And that was the areas that did get face-fit masks. Many areas in healthcare, medical wards and areas where COVID patients were nursed did not get these masks. They were using the waterproof blue masks of various qualities.
We've also heard some evidence this morning and on other occasions in the inquiry about the use of particularly masks where the best before date or the sell-by date has been changed. Is that something you've come across?
Yeah, we certainly came across that in the union. There was several photographs circulated of masks where the dates had been printed over, stickies put on them. The union, actually, Unite the Union and the joint trade unions and GGC raised this at various points. These masks appeared to be removed, then appeared in other areas. There was also a set of masks that gave off fibres when you breathed them in, and they were again removed at some point, but turned up again later on. There were circulars, in fact, there were official or semi-official circulars put out with the codings of masks that had been tested to be able to have their dates changed, and the dates on these boxes were indeed changed. That was the rationale given to us in the trade union.
What did you feel about that?
I think it was extremely concerning and did not necessarily fill staff or us as trade union officials with confidence.
Now, your work, as you tell us at paragraph 30, increased massively.
Yes.
And you kept what you termed a dossier
Yes.
of issues, and you provide us with some information about some of those.
Yep.
One I'd like to ask you about is shielding,
Yes.
which you refer to in paragraph 31 of your statement.
Yes.
Was there, in your view, dubiety about the shielding definitions and the categories into which people might fall?
Yes. I can use several examples, but the conditions for shielding, asthma was an obvious one, but what level of asthma did one require to have to fit a shielding category? Nobody really was clearly sure of. Asthma on using an inhaler, or was it exacerbated asthma? And it left people with asthma feeling very, very vulnerable and not knowing if they should be shielding or not. The other group, significantly, we had significant contact with professionally and in the union, was pregnancy.
Yes.
And there was significant dubiety. Were you allowed to shield? Were you enabled to shield if you were pregnant? Were you vulnerable? No, you weren't. Was it after 3 months? Was it after 6 months? Nobody knew. The evidence base was beginning to become available of increase during pregnancy. There is an anatomical or physiological reason why you are more vulnerable to viruses. And the evidence was beginning to become available, and it took some time to get some clarity about who and at what stage of pregnancy you should be shielding or protected and moved into a less risk area of working. Many pregnant nursing staff or health staff wanted to be working in some capacity, but it seemed that you were either off altogether and shielding, or you were frontline. It was very, very difficult to decipher what a shielding pregnancy category would be till further down in the pandemic, probably about June.
Were you being asked for advice on these things?
Yes.
And were you able to give that advice, or were you able to point people in the right direction where they might find things?
We would engage people to ensure they were referred to occupational health and complete, by that time, certainly in my board, there was a health risk assessment which would be completed and then discussed with occupational health. But some of our members received calls, screening calls from pertaining to be occupational health, who in fact were perhaps other members of staff that were asked to check the screening form rather than actually be occupational health employed staff.
What was your view of that?
I would have rather it was with the occupational health team who were trained to ensure that these forms were completed and the risk assessment properly carried out.
Right. Tell us a little about policies and processes. And I think
they were almost changing on a daily basis.
I think we've heard that. If we can put it that way, Mrs. Hare, that the changes in guidance seem to have been across the board and
it was
constant.
chaotic. As a union, we would meet, and joint trade unions, we would meet to sort of decipher after a few days, what did this latest change mean? I think our view as trade unionists was to ensure we went for the safest measure within the guidance that was happening, not the softest measure. And at times we got the impression that our management or our health service wanted to go down the softest measure rather than the most secure. And it just was chaotic. Who wore PPE, when you wore PPE, particularly in community staff, what services were stopped, what services were starting, what continued, who could visit who, where, and when. It really was extremely hard to keep up with.
You presumably had a role, as an expression I've used on a number of occasions, as a pivot between those who were providing that guidance, whether it be the government or other public bodies, and your membership.
Yes.
How difficult was it to do that?
We obviously met as an area partnership forum with management within NHS GGC and would voice our concerns. We were also enabled to voice our recommendations after speaking to our members. And such a recommendation was regarding health visiting services for children and families in the home, which had been stopped, and the vulnerability of families and children, particularly around being supported, promoted and safeguarded in their own homes, which is the GERFEC principles that we work to within NHS Scotland. We were able to influence that, in fact, these services were important and should be continued. Another example was childhood normal immunisations, not COVID immunisations, and the importance that children still had access to health care to enable them to be vaccinated.
One of the things you mention in paragraph 34 is that certain COVID pages were introduced into the Health Board's core brief. Can you just tell us what the core brief was and what status it had?
NHS GGC publishes a core brief daily, and that was updated with any guidance. It's available online. So you have to be able to log into a computer and have time to read the core brief and see that. Many of our staff did not have that time.
And if guidance was changing on a regular and rapid basis?
It caused confusion.
I'd like to ask you a little about a personal impact that you tell us about. This is at paragraph 44 of your statement. Now, again, can you avoid actually naming anybody or naming?
Yeah, I have realised I've named in my statement, and I won't.
Right.
However, it was at the very start of the pandemic when specific groups had been set up, and I was part of the Glasgow City Staff Partnership Forum, attended a meeting in person. So this was before many of us were working purely from home, and a senior member of staff chairing that meeting shared that we'd be setting up a specialist assessment and treatment area in a fairly central health centre within Glasgow City. However, it did look like patients over 65 would not be directed to attend there. They would be remaining at home. I was in fact 64 at that point in time, and it really left me running blood cold. I can still feel quite emotional about it, because I just felt the room turn chill at that point. and for the first time felt vulnerable and thought, right, I'm too old to matter. That is a fairly personal statement to say, but I'm older now and I still don't feel old and too old to matter. So it left me really feeling quite vulnerable and worried. The meeting further went on to discuss the patient frailty score, which you may have heard about, which again left me feeling very concerned because, as I've stated in my statement, my code of ethics as a nurse, and I do stress now I've been working in the profession for 50 years, is to always provide life-saving care.
Do you feel that that was being complied with?
Yes, but I think there was an awful lot of ethical people at an individual level were asking ethical questions of themselves. But I think some groups of patients did not easily access specific care.
You've provided us very helpfully, Mrs. Hare, with some lessons to be learned and some hopes for the inquiry, and you particularly have regard to what you say at paragraph 57 of your statement, where you say there was an impact on children and families we support. There was a big difference when health visitors were able to go back and see families, and it's your belief that this should never have been stopped.
Absolutely.
Okay. Do you know if your union or you personally made representations in relation to that?
We certainly personally and as a union and as a profession really advocated on behalf of children and families. Our primary focus and role, particularly within Scotland, is support and safeguard children within the Getting It Right for Every Child principles. And we felt we now know there's evidence base of the difference that has made to children in Scotland over the years that the Getting It Right has run. And at that time, we felt we were leaving vulnerable families high and dry, particularly families who may not have had access to high nutrition, we may not have had access to outdoor space. We were working within Greater Glasgow and Clyde, and we also know that the vulnerability of children from a child protection perspective of families suddenly always being at home and being isolated, not being able to necessarily see grandparents or other peers, was leaving children extremely vulnerable.
As I said, my colleagues from the other portfolio in the inquiry will be in touch with you about various matters, including issues in relation to children and young people.
Thank you.
At this stage, Mrs. Hare, that's all I have to ask you. As with all witnesses, we offer you an opportunity. If there's something that you would like to say that you feel hasn't thus far been said or said with sufficient force, this is your opportunity if you would like to do that.
I very recently, in the last month, have gone back into a senior nurse role in an HSCP, and actually I'm working with a number of the students that were redeployed during that period of time. And I think all of that group would say they are suffering from some form of post-traumatic stress from their experiences during that time. I've had that opportunity to meet with them. I'm working with them just now. We're seeing an increasing number of competency issues in staff that trained during that time. I've put that in my statement.
Yes.
And they had a remote learning experience. They didn't have experience of that 50% in practice with peer support, and they are certainly feeling that. But against that backdrop of what we've said of the impact on children and families, an increasing need in the families that they are visiting post-pandemic.
Mrs. Hare, thank you very much for engaging with the inquiry and for your evidence today.
Thank you very much for having me. Thank you.
Thank you,
Thank you,
Mrs.
my
Hare.
lord.
Thank you.
Thank you.
I forgot you were on the screen there.
Yeah, thank you, Mr. Gill.
Thank you.
Tomorrow morning at, I think, 9:30, is that it?
9:30 again tomorrow, my lord. Yes, thank you.
Thank you. Till then.